Hi, Bureau Valley girls. Oh my gosh. We are going to be showing the performance skill video for applying and removing PPE, personal protective equipment. So here we go.
It's so weird because we can't see your mouth moving.
All right, let me get this pulled up.
Performance skill number 17. Apply.
Okay, here we go. Performance skill number 17.
Performance skill number 17. Apply and remove personal protective equipment. Standard, apply and remove personal protective equipment without contamination. May be tested in the classroom or in the clinical setting. Identify type of isolation required. Apply appropriate personal protective equipment outside the isolation room. Gown. Applied gown and secured it at neck and waist. Mask. Place mask over nose and mouth, secured appropriately. Gloves. Apply gloves appropriately. Remove personal protective equipment inside the isolation room. Gloves. Remove gloves appropriately. Wash hands. Gown. Remove gown appropriately. Washed hands. Mask. Remove mask appropriately. Washed hands. Discarded personal protective equipment appropriately.
Okay, let's chat now about it. Have your skills packets open because you guys can make some notes. So, of course, as always, we're going to perform our beginning tasks. And then, step 2, it says identify type of isolation required. So, if somebody is on isolation in a room, they are going to have a sign on their door stating what type of isolation. This chapter, chapter 6, we're going to learn the different types of isolation: contact, droplet, and airborne. And we'll learn that in lecture, okay? But the door will always have a sign stating what type of isolation they are on, okay? And so you're going to look at that sign, see exactly what you need to put on before you go in that room. And then the PPE will be outside of the room for you. On step number 3, I want you to highlight, underline, circle, apply PPE outside of the isolation room. You will always put your PPE on outside of the room. And like I said, it will be out there for you. Why do you think that is? Why would we put it on before we go in the room?
So that it doesn't get contaminated in the room.
It doesn't get contaminated when you're in the room?
So then your scrubs that you're wearing don't get contaminated in the room because they're clean.
Your scrubs won't get contaminated in the room. If someone's on isolation, that room, what's going on in there?
Germs.
Something that you don't want, okay? You're only on isolation if you have something that's highly contagious and you do not want to spread that from person to person. You do not want any infection or bacteria that they have getting on your clothes at all. Obviously, a lot of residents are not on isolation. They may be ill, but they may not be on isolation. An example, C. diff. It's a type of GI bacteria, gastrointestinal system, that causes severe diarrhea and it's highly contagious. And it's bad. You don't want it. If someone has C. diff, they would be on contact isolation. You'd have to put all that stuff on before you go in their room. So there's different illnesses that require isolation precautions, okay? That is one of them. So whatever's going on in that room you don't want, that's why you're completely protecting yourself. So we always put it on outside of the room, okay? So you're gonna put it on in a certain order. Your performance skill packet states gown, mask, and gloves. That is the correct order. Up here though, if we need to put goggles on, I added where that comes into play. So here is the order of these four things: gown, mask, goggles, gloves. That is the order in which you put them on. Don and doff are two vocab words for this chapter. Don means putting PPE on. Doff means taking PPE off. Why did they have to add the D? I don't know. It is what it is. Okay, so you put it all on outside of the room and you're ready to go in. So you go into Mr. Jones' room, you do what you need to do, and it's time to take it off and leave. Where do we want to remove the PPE? Number 4, inside the isolation room. You don't ever want to go outside of an isolation room with your PPE still on. You want to take it off right before you leave. Why? Because if we just took care of them and now we're stepping outside of their room into the rest of the facility with germ-infested PPE, that will not be good. Okay? The order in which you doff or remove PPE is right here: gloves, goggles, gown, and mask. The video showed the person washing their hands after each article of PPE was taken off. You do not have to do that. You can wash at the end after you've taken everything off, unless what happens during the process?
Unless you touch the...
Your hands become visibly soiled during the process, or you touch the outside. The goal when we take it off, which me and Jill will show you, is to not touch what's contaminated. But if you contaminate your hands at any point, wash them immediately. Otherwise, if you take it off properly, you can wash your hands at the end. After taking off PPE, we must wash our hands with what? Soap and water. Hand sanitizer is not going to cut it after we take PPE off for obvious reasons. We were just in a room with a highly contagious or highly infectious illness. Soap and water has to be used after PPE removal, okay? All right, and then you would discard of it. We'll show you how to do that and do your completion tasks. Any questions on that? Me and Jill are gonna go into the lab. We're all gonna go into the lab and we're gonna show you. Yes, Bridget?
What about a mask? If we had to do a mask, would we have to put a different mask on than ours?
Great question. Yes, and why do you think the answer to that is yes? Did you hear Bridget? She said, do we need to put a different mask on than the one we have on? The answer is yes. Anyone know why?
Because that one's getting...
You're in a room, isolation room, you don't want your personal mask in there. So you're gonna put a disposable one on that you'll throw away before you leave the room. Good question. Any other questions? Yes, Ingrid?
So I read in the book, like, if you get your gown dirty when you're in the isolation room, you have to, like, change it and then go back to doing the task, I think it said.
If it's visibly soiled, say you're in caring for someone with C. diff and you're changing them and your gown gets dirty, it would be a good idea to change it. Otherwise, wherever you go, or say you just clean them up, but you still have to make their bed, get them new linens on their bed, and you have a dirty gown. Go over or take everything off, change it, and then go back in the room. Take everything off in the room, get rid of it like you're supposed to, and get a new gown. If you have stuff yet to do, so you're not spreading that around, okay? Good? Any other questions? Okay, so before we go in the lab, this is what's going to happen after we go learn more about PPE. Once we show you the skill, here are the different things that I want you guys working on for the rest of class today. I want you all to go get around of putting PPE on, practicing our new skill. Blood pressure, I know that's one we all need a lot of practice with still, so you can practice blood pressure, and you can practice pericare if you feel like you want some practice on that. Remember, pericare is a skill that we'll be doing in clinical. We won't be testing in lab, so you have a while yet till that one comes, but you still want to make sure that you're knowing it, okay? Blood pressure, October 20th is our date that we're aiming for. So we'll be working on that every day that you have an opportunity. There are 2 videos on Schoology that you guys could watch today with a partner if you choose, if you have not already. One is the one we watched in here in class, and another one is similar, but it gives you that practice of reading the gauge. Otherwise, hands-on practice with blood pressure is always.
But that's usually the protocol.
All right, infection control. Let's open our books to chapter 6 if you have not already. And we'll begin. So this is, I told you guys on Monday, a heavy chapter because it's so important to us. Everything we do every day on the job in the healthcare profession, we're always thinking about infection control. We should always have infection control in the back of our mind. Because we as healthcare providers, what's our goal? To make our residents healthier, promote their health. And so it's our job, because of that, to practice good infection control measures so we are not making them sick, okay? Or sicker than they already are. So what is infection control? What is infection prevention? What are we talking about when we talk about that? Methods used to control and prevent the spread of disease. Everything we do every day on the job to prevent the spread of disease or illness. Whose responsibility is it to practice proper infection control? Yours, mine, dietaries, housekeepings, the doctor, the nurse, the physical therapist. All members of the healthcare team are responsible for practicing good infection control, infection prevention measures. Like everything we talk about, know your facility's policies on infection control and follow them. When we practice good infection control or infection prevention, we're helping ourselves, we're helping our residents, we're helping the family members of the residents, we're helping visitors. It's something we do for everyone. It helps and protects everyone. We're not in biology class, but we need to talk a little bit or know a little bit about the types of microorganisms that exist and which ones harm us and which ones don't. So a microorganism, you guys already probably all know, is a tiny living thing that's visible only with a microscope. We cannot see them with the naked eye. You may also hear them called a microbe. Microorganisms are always present in the environment. They're everywhere. They're always present. Are they all harmful? Do they all cause infection? No. There are harmful microorganisms and microorganisms that aren't harmful at all. We'll talk about the difference. In order to acquire an infection, it takes a harmful microorganism, also known as a pathogen. So you now know what pathogen means. It is a harmful microorganism that causes infection. We all have microorganisms that live within us. Does that mean we're all sick? No. We have microorganisms that live within us that don't do any harm to us. But if we are invaded by a pathogen, a harmful microorganism, we may become ill. We could become ill. Pathogens invade and grow within the human body, and then an infection could potentially develop if your body is not able to fight it off. So we have microorganisms, harmful, not harmful. The harmful ones are called what? Pathogens, and those are what cause infections. There are two types of infections that we're going to discuss: localized infections and systemic infections. A localized infection is limited to a specific area of the body. On that specific area, you will have local signs and symptoms: redness, swelling, drainage, pain, warm to the touch. Those signs and symptoms will be specific to that localized area of the body. Can somebody give me an example of a localized infection?
When it keeps getting reinfected.
No, I want an example of a localized infection. An open wound that's infected. I have a wound on my forearm. It's pussy. It's got drainage. It's red. It's swollen. It's inflamed. That's a localized infection. It's right there on my arm. Another example. A pressure sore that becomes infected. It's localized to that area of the sore. Any sore or wound on the body, localized infection. Anything else you can think of? What about pink eye? Your eye becomes infected, red, sometimes has drainage, sometimes swollen. It's localized to your eye. Tonsillitis, infection of the tonsils. Your tonsils will be red, swollen, may have drainage, localized to the tonsils. Okay, make sense? We also have something called systemic infections, which occur when a pathogen enters the bloodstream and moves throughout the body. With a systemic infection, we're going to have generalized symptoms that we cannot pinpoint to our eye or our tonsils or a wound on our arm. We cannot pinpoint the symptoms. General symptoms will include fever, chills, headache, change in vitals, nausea, vomiting, or diarrhea, and mental confusion. Generalized symptoms. Who can give me an example of a systemic infection?
Certain cancers can have like these signs.
Certain cancers can have general symptoms, okay. What else? What season are we coming upon? Flu season. Influenza is a systemic infection. You can't pinpoint it to an arm or a leg or a tonsil or an eye. It's systemic. It has symptoms such as fever, chills, headache, etc. Yes? Coronavirus is a systemic infection. It's not a localized infection. What else? HIV is a systemic infection. Okay? Do we understand the difference between the two? Okay. There is something called healthcare acquired infections, healthcare associated infections, and those are infections that are acquired within a healthcare setting. So you send your grandma or grandpa to the hospital for something. Do you anticipate them acquiring a new disease or illness while they're there? No, we anticipate the opposite. We anticipate them to become healthier, to be taken care of. So HAIs, do you think they're a good or a bad thing? Bad. We do not want someone to go into a healthcare facility and become ill. Infection control, infection prevention, that's why we practice this. So we do not infect people who are in the healthcare system. What are some different healthcare settings we've talked about in this class so far this year? Chapter 1, think back to it. We have what?
Long-term.
We have long-term care facilities like nursing homes, assisted living homes, places like exceptional care where they house the developmentally disabled, all long-term care. Yes?
Hospice.
Hospice care, yes?
Acute.
Acute care, what's an acute care setting?
Like ER.
Hospital. Acute care, remember that, acute meaning short term. Hospitals, ambulatory surgery centers, clinics, outpatient clinics where people are in and out, acute, short term. All of these healthcare settings have one common goal: to make people better, not worse. So healthcare associated infections are not good. An example, a patient goes into the hospital, they put a urinary catheter in, and the urinary catheter causes a UTI. They didn't have a UTI when they went in the hospital, they got one while they were there. Hospital associated infection. Excuse me, healthcare associated infection. Here is just another reminder of what localized infection signs and symptoms will be: redness, swelling, pain, heat, and drainage in that specific area. And then our systemic infection signs and symptoms are more generalized. We can't pinpoint them to a certain area. Fever, chills, headache, change in vitals, nausea, vomiting, diarrhea, and mental confusion can all be generalized symptoms of systemic infection. Systemic, think system. Your whole body is a system. Localized, a local point on your body. Pathogens prefer a certain type of environment. Again, a pathogen is a what? A bad bug, a harmful microorganism. Pathogens prefer this type of environment. Somewhere that's warm, dark, moist, food's present, and they really like hosts with low resistance. What do I mean when I say a host? A person. They go after people with low resistance. Why? Because they can. Those people can't fight back. Those people can't get rid of them. So, who are some types of people, who are some populations of people with low resistance? Linnea.
Cancer patients.
Cancer patients, why?
The chemo.
The chemo, the immunotherapy drugs, lowers their immune system. They are very susceptible to pathogens. Somebody else had their hand up.
Elders.
Elderly. The elderly are more susceptible to illness because as we age, our immune system weakens, along with other things we'll talk about here in a little bit.
Pregnant women.
Pregnant women can be more susceptible to some illnesses, yes?
Isn't it like donor recipients get like really low immune system?
People who had blood taken? What do you mean?
No, like people who like receive lungs and hearts. Like
Oh,
transplant.
people who have donor
Yeah.
organs. Sometimes, yes, because it's not their own. Sometimes their body rejects it, which lowers their immune system. Could be, yes.
People who have like other pre-existing conditions.
People who have other underlying or always a good thing. Okay, so after we show you the PPE, these are the things I want you to be working on. All of you, majority of you in this room are tested on blood pressure and TPRs. Round of applause.
Bed making and
Yes, bed making and TPRs. Those were due last week. You are my biggest class, and you're also the class who got those two things done the quickest. So good job on that. I'm very happy about that. So today, if you want to test on anything else that you haven't, grab me and Jill and we can do that, okay? I have the other two blocks today, practice documentation. So today, during your practice, I want you to document everything you do. If you take a blood pressure, write who you took it on and write it down. If you do pericare, write did pericare.
male or female.
Male or female pericare. If you put PPE on and took it off, write that down. Document everything you do practicing in lab today, and I want that turned in at the end of the class, okay? Not only is it a good practice for documenting our work, but me and Jill can't be everywhere at once. So it's also nice for us to see, what did you do today, okay? Blank piece of paper is fine, just make sure your name's on it so that I know who did what. And we are, after you get those out, we're gonna head into lab to watch Jill and I talk a little bit more about PPE. Kylie, you're in charge of the GoPro, right? All right. So grab your stuff and head into the lab. If it'll stay there, and it's good on me and Jill. I don't know, I don't think that moves.
Should be.
It's okay? You can see
Yeah.
us?
Can you even see through this thing?
Just tap on the screen.
Oh, there it is. Oh, you gotta go down. Has to go down.
You might have to hold it.
Yeah, that's good.
You good? Okay. All right, so here is our little scenario. We have our PPE station. Here is our door to our room, stating that this person has isolation precautions and some pictures. So we know that we need to put on some PPE before we head in there, okay? We have gate belts, just kind of showing you a line. This is outside the room. That's inside the room, because that's important with PPE. We must put it on outside and take it off inside. So, if you remember from in there, what goes on first?
The gown.
The gown. Okay, so Jill's gonna put a gown on and we're gonna talk about what we're looking for when you put the gown on.
We'd like you to reuse these,
Mm-hmm.
so they're kind of all folded differently. But we'd like you to reuse them so we have them available. So this one's inside out.
Okay, so open to the back, okay? You don't wanna put it on like a jacket, you want the back side to be open.
This is the hard part. You may not believe this, but it is.
So she has a tie at her neck that she's going to tie. Tightly. Don't choke yourself, but kind of. No, I'm just kidding. You want it tight because you want all of your what covered?
Shoulders.
I didn't
Scrubs.
get it.
So we
Help me
can't
with it.
tie, we can't cover her entire neck. We'd have to hide her like that if we wanted to
We
do
can
that.
do that.
Sorry. We don't want any of her clothing hanging out, because if we have a split splash on Jill's scrubs, she would then need to go home and change. So we tie it nice and tight around her neck without choking her to cover her scrubs. I'm not choking you, am I? Okay. Okay? So if you put a gown on and half your shoulders hanging out, your gown's not on correctly, okay? Now she's gonna tie at her waist.
Could you help me, please?
And then, this is okay. She's gonna ask someone, because she doesn't have eyes in the back of her head, how's my back look? And if she goes walking into a room like that,
Like the lady on the film.
Yeah.
Did you notice that in the?
not good. So we don't want that. We want her entire back covered, so she can ask a coworker or a friend, hey, how's my back look? And then you can fix her up if you need to, and now she is all covered. Okay? Wanna talk about your hands?
So what I do is I leave the gown down, like right in there. Because then when you go to put your gloves on, they'll go over the gown. Because what you don't want is the gloves sliding your gown up, because then what have I got?
Clothing should be.
Clothing.
Clothing showing and possibly getting contaminated, and you know what happens after that. Gotta change. So, gown is pulled down a little bit before she puts her gloves on. Okay, so we have her gown on correctly. What's next?
Goggles.
Mask.
Gown, mask, which she has on. So we just talked about, Bridget asked a great question. Can we wear our own mask in there? You don't want to, because you don't want it going in an isolation room. So we would always take our mask off and put on one of these. Now, a year ago, we weren't wearing masks all the time taking care of residents in the long-term care facilities and hospitals. So we didn't have a mask on our face, so you just put one of these on. You can switch yours out with a disposable. So we all know, we're all pros now at putting masks on. I don't think we need to explain that. So Jill has her mask on. So gown, mask, then what? Goggles. If you need them. A lot of isolation precautions you don't, but you may, so we like to throw that in the order, okay? Gown, mask, goggles, and then gloves. So Jill is gonna pick her glove size. Put them on. We all learned how to put on and take off gloves when we did the little catch-up activity.
See, I've got that way down in there, but I can always pull back.
And she's not exposed.
Right.
She has some wiggle room there.
Okay, so it's way down there. All I gotta do is pull back. But it's gonna stay in there then.
Okay. So she has all of her PPE on. And now what do you guys think is really important she also has before she goes into a room to do anything with a resident? So she goes in there and she's got everything she needs. Wash hands, assemble equipment. So any equipment she needs before she goes in that room, she wants to think again, and think a third time to make sure she has it all. Because when she goes in, what can't happen? She can go out when she's done, but say she goes in the room and she's getting ready to do a bath with Mr. Jones and she goes, oh no,
I forgot the washcloth.
Can she go running out to get her
She
washcloth?
has to take everything off.
She has to take everything off, go get the washcloth, and then put everything back on, or she can phone a friend, put the call light on, and someone could bring her washcloths. But how do we avoid that whole situation entirely? You bring all your stuff in. Now, we're all human, we all forget things, we all make mistakes. A lot. So, worst case, you forget to bring something in, you know your two options now. Take everything off, go get it, put it back on, come back in, or phone a friend with the call light. Paige.
Say you forgot something, you would need to put all new PPE on.
All new PPE.
Okay, and then when you phone it, like when you call like another, like how would they give that to you without like them getting contaminated without and like you walking out?
Usually in a room you have a door and then you have a ways before you get to the resident. They could open the door and hand the washcloth into you. Yes?
I was gonna take the washcloth. You didn't hand it to me. There you
Okay.
go.
So you could do that, okay? The best possible scenario is you don't forget anything, but we all forget things, and so either of those two things is okay. Good question. What is that?
I really don't know. I've been watching it all day. It hasn't moved. So.
I haven't seen that before. It looks like a milk dud or a
Molten milk.
molten milk ball. Okay. So she's in the room. She's doing what she needs to do with Mr. Jones, and she is now ready to come out of the room. She's done with all of her work, and she's ready to remove her PPE. Where does she remove it?
Inside.
Inside the room. What does she remove first? Gloves. You are right. We all know how to remove gloves that are full of ketchup now. So that is how we would first take our gloves off. Ball them up. Slide under. Roll off. Okay. She would need to wash her hands at this point if she soiled them. Otherwise, she can move on to gown. Goggles, sorry.
I was gonna say.
Yep.
Okay.
Which, if you reverse that, it'd be fine, but the sooner you get the goggles off, the better, because then your vision's not clouded. Get the goggles off after you take the gloves off. You want to take the gloves off first, because your gloves are probably the what? Dirtiest. So you take those off first. She took her goggles off. Now she's going to take off her gown. How do we do that? So she's carefully reaching behind her to untie the first string. Carefully reaching behind her head and untying the neck. She's going to do a little shimmy to kind of loosen her shoulders, and then she's going to go underneath of the gown. And then roll the gown inside out, kind of like we roll dirty bed sheets. And get rid of it. Okay, if she felt like she soiled her hands doing that, what can she do? Wash them. And then she's going to take off her mask by not touching what area of the mask? Go behind your ears, and pull away from your face, okay? And then discard the gown. And then pre-existing health condition, anyone who's already sick or has a health condition sometimes will have lowered resistance, lowered immunity. Very good, all very good examples. You want to know that this is the types of things that pathogens prefer to grow in or do best growing in. When we talk about infectious diseases, those are diseases that are caused by pathogens. What are pathogens? Bad bugs, like Lahea said, harmful microorganisms. I've asked you that 4 times now. You obviously need to know what a pathogen is. There are 2 kinds of infectious diseases: communicable and non-communicable. If a disease is communicable, what does that mean? It's contagious. You can spread it from person to person. Communicable is when a pathogen is spread from person to person. Some examples. Back in the day, before you guys, in my time, my old time, when we were younger in my childhood, chicken pox, we got it. Everyone got it. You wanted your kids to get it. Now we have a vaccine, so nobody gets it. But that was an example back in the day of one very contagious illness. I had chicken pox when I was 10 years old on Christmas. All 5 of us, I have 4 siblings, all 5 of us had chicken pox. And it was just a thing back then. You got it. You wanted to get it, so you're done and over with it. Done and over with it. Is that right? I don't know. Nowadays we have a vaccine. Strep throat, contagious. You can spread it from person to person. Influenza, contagious or communicable, can spread from person to person. What else? What are some other communicable diseases? COVID, very communicable, very contagious. You can spread from person to person. That's why we all have to wear these. What else? The common cold, it's contagious. You can spread it from person to person. Very good. If a disease is non-communicable, you cannot spread it from person to person. Examples, asthma. I can cough all day in all of your faces and you'll never contract asthma from me. It's not communicable. Emphysema is a disease of the lungs that you cannot spread from one to the other. Not possible. What else? Diabetes. Can't spread it from one to the other. Allergies. Not communicable. Cannot spread them. Cancer. Non-communicable. Cannot spread that from one person to another. Anything else? There are a lot more communicable diseases than there are non-communicable, but they both exist. Cross-infection or cross-contamination, they mean the same thing, is acquiring an infection from someone else. Cross-contamination. I just contaminated Spencer, cross-contamination. How can we stop cross-contamination? What's our chapter about? Infection control. Cross-contamination can be stopped by good infection control methods. If we can practice really good infection control methods, we can prevent the spread of illness from one to another. Reinfection is just a vocab word in your books that means being infected a second time. Some more terms we're going to talk about. These are all vocab terms in your book that we're going to discuss briefly so you get a better idea of what they mean. We all know what transmission means. Transmission means what when it comes to illness and disease? how it moves from one to another, right? How it's transmitted. Infection prevention is about breaking this transmission, breaking the spread from one to another. Transmission of a disease can be blocked by using proper infection prevention practices. What do you guys think the main practice for infection prevention is? Hand washing is the number one main infection prevention method. Good, proper hand washing. Medical asepsis is a term you'll want to know. Medical asepsis is measures used to reduce, remove, and control the spread of pathogens. What are some things we do every day to reduce, remove, and control the spread of pathogens? What are some things you do every day to do this? Right now, in our world, we're wearing masks every day. Medical asepsis. It's a method that we're using to reduce the spread of pathogens. What else?
Washing our hands.
We wash our hands. That's medical asepsis. Practices we do every day to prevent the spread of disease and illness. What do I make? Well, I don't make you guys do it because Paul comes in after third block, but why do I have those Lysol wipes sitting over there on that desk? To disinfect the tables in between classes. Medical asepsis. Keeping things as clean as possible. Medical asepsis is used in all healthcare facilities. So, question, when I go grab a Lysol wipe and I wipe down the desk after class, am I removing all microorganisms from that desk? No. Medical asepsis cannot remove all microorganisms. It can remove most, but not all. The only way to remove all is sterilization, and we'll talk about that in a second. So medical asepsis, keeping things clean. You can write that down in your notebook. Medical asepsis equals clean. We also have something called surgical asepsis. When we talk about surgical asepsis, we're talking about something being sterile. And when something is sterile, it's what? Completely free of what? All microorganisms. All of them. Medical asepsis, most, but not all. Surgical asepsis, sterile. Completely free of all microorganisms. And we'll talk about what certain circumstances are that we must use sterile equipment and how things are sterilized here in a second. We need to know clean versus dirty. Those are two vocab words. Clean means not contaminated with pathogens. Dirty means contaminated with pathogens. Easy. If you have ever worked at a healthcare facility or been in a healthcare facility, you may have noticed there are rooms that are labeled clean utility room, dirty utility room. All healthcare settings will have clean utility rooms and dirty utility rooms. Anytime we're getting ready to enter a clean utility room, it's important that we do what? Wash our hands. We're going into a clean utility room. We're going to touch clean equipment. We need to wash our hands. What are some things you think we can find in a clean utility room? What do you think we keep in a
Clean
clean?
PPE.
PPE. What else? Linens. We keep all our linens in clean utility room. What else? New bedpans or urinals or bath basins or emesis basins, toothbrush, toothpaste. All the equipment we use all the time, the new equipment we might need on the job is kept in a clean utility room. Your resident just gets admitted to the facility and they're gonna need a bedpan in their room. You go to the clean utility room, get a bedpan, bring it in their room. It's now their bedpan. Your resident needs you need to go make your resident's bed, occupied bed making. Where do you go get all your linens? Clean utility room. Dirty utility room store dirty laundry and equipment. So after we go change Mr. Jones's bed, we have a bag full of his dirty linens. We will probably bring that into the dirty utility room and put it into the big laundry basin. Okay? Anytime we are getting ready to leave a dirty utility room, we must wash our hands. Obviously, we're in a dirty utility room. We're going back out onto the floor. We need to wash our hands. Every single dirty utility room I've ever been in has a sink. You'll wash your hands in there before you leave. It's also good practice to use a paper towel to open that door, because you don't know what the person before you was doing or did, right? So you don't want to go back out onto the floor after touching a dirty door handle in the dirty utility room. It's good practice to do that in the bathroom also, because imagine this. You go to the bathroom, you wash your hands as good as you possibly can, throw your paper towel away, then you go and grab that door handle that the person before you just grabbed after not washing their hands after going number 2. Yuck. Think about when you go to restaurants and stuff. You go to the bathroom and then you open the door. What if the person in there before you had something on their hands they didn't wash off? Then you go back and sit down and start eating your food.
That's really gross.
It's very gross. That is why we ourselves can use a paper towel to open that door handle so whatever may have been on that nasty door handle doesn't get on my hands, because I used a paper towel. So think about that every time you open a bathroom door. You don't know what Mr. Jones before you had on his hands. You can practice hand washing all day long. And we must do what when we're all done with that? With soap and water. And then we've done all our completion tests and we can leave the room. Any questions? Okay, we have 2 stations for PPE set up here. I want to save these for PPE practice, and these 2 mannequins I'd like to save for peri-care. Actually, for this class, it really doesn't matter because they're basically done. We got to save 1 bed for bed making.
Peri-care you could do on these 2, and that could be
That
bed
could be
making.
bed making.
Yeah, 'cause that's
So
what male
this
female.
bed 3, 1, 5, and 4. These 4 are open for any skill you want to practice. And that one we're going to save for bed making. So that list of things in the lab, that's everything you can work on. Please document and turn in to me by the end of class. Okay?
Emma, do you want to do ambulating for you? Yeah.
All right, lady. Yes. Are you ready for both? Which one would you like to do first? Okay.
No,
You're up.
I don't know what to do.
I think we're done.
Oh, yes, we can. I have a Sharpie.
I'm gonna have a marker right there.
What are you looking But you don't know what other people are doing, so everything you touch, you gotta kind of think about. That's why hand hygiene is so important. Bottle of hand sanitizer. So, think about that when you leave a dirty utility room. That's a good extra measure to prevent the spread of infection. Disinfection versus sterilization, 2 more vocab words. Disinfection is like when I use a Lysol wipe. I just told you, I wiped the table off with a Lysol wipe. Did I remove that table? Did I remove all microorganisms from that table? No. Most of them, not all of them. So disinfection goes right along with medical asepsis, removing most but not all microorganisms. Sterilization, on the other hand, frees something from all microorganisms. So how do we sterilize things? An autoclave. An autoclave is a big machine that sterilizes things. Hospitals will have autoclaves in their central supply area, and they can sterilize all types of equipment using an autoclave. It kills all microorganisms. You can boil things at home to sterilize them. Of course, the minute your hand touches them, they become unsterile. but like women who breastfeed, they tell you to sterilize the parts of your breast pump, and so that's how some people can do it at home, is boiling. But in the healthcare facilities, an autoclave will sterilize anything that needs to be sterile. Can anybody tell me what some different procedures are that they know of that are sterile? Sterile procedures? What types of things go on in healthcare facilities that have to be sterile? Allie?
Well, like pretty much any procedure that's done in the OR has to be.
Operating room, surgeries, they're all sterile. If you've ever seen a doctor or a nurse barbed up for surgery, they are in all sterile PPE, sterile gloves, sterile gown, sometimes sterile boot covers, all sterile instruments. Yes, the OR, very sterile area of the hospital.
It's like when you're getting a shot, like the needle has
The
to be-
needle on any shot is sterile. So if the nurse took the cap off and somehow touched that needle, it's no longer sterile. That needle is completely free of all microorganisms before it enters your skin. Very good. Anything else? Urinary catheter. When a nurse places a urinary catheter, that is a very sterile procedure. She has to wear sterile gloves, and he or she has to have the whole packaging that you open. Everything within a urinary catheter kit is all sterile, because we're putting a tube up the urethra, right? What happens if we break that sterile field before we put that tube up there? What could we cause?
infection.
Urinary tract infection. Not good.
For sterile gloves, would that be different, like to like put on, like, because your hands are like,
Yeah.
are those different?
Sterile gloves, we are going to practice this year in this class putting on sterile gloves. And so Paige leads me to that point. We as CNAs, do we perform sterile procedures? No, but we don't perform them, but we may be asked to assist or help or go grab something and put it onto a sterile field. We will learn in this class how to put on sterile gloves. All of you will get a package of your own sterile gloves, and we will learn how to put them on and keep our hands or our gloves sterile. So if you're asked to assist in a sterile procedure and the nurse says, hey, Nevaeh, I forgot my IV needle. Can you run and grab it and put it onto my sterile field? And when I say sterile field, I mean the nurse has all of her stuff open and ready to go for the sterile procedure. So here's a sterile field. All of the stuff on there is sterile. So she asked Nevaeh to go grab her the needle that she forgot and to put it on her sterile field. So Nevaeh goes to the clean utility room and she grabs the needle that the nurse needs. Can she touch this packaging with her bare hands?
No.
Yes.
Oh.
The packaging isn't sterile.
Oh.
You're not touching the actual piece of equipment. The sterile piece of equipment's inside here. So I can touch the packaging with whatever I want. So what happens if I go into the room and I go like that onto the sterile field?
Nothing off the sterile tools.
I just ruined the sterile field and nothing is sterile anymore because I just threw something that I touched with my hands onto the sterile field. Okay? Sterile means free of all bacteria. So how can I put this piece of equipment onto the sterile field sterilely? Just like this. I didn't touch the piece of equipment, the package is still in my hands, and I just dropped it right onto the sterile field, and that's okay. So that is how we would add any type of equipment, any piece of equipment onto a sterile field without contaminating it, okay? We'll, throughout the year, I'll get more things that will open sterilely, and we'll practice different ways to assist in sterile procedures, and of course learn how to put on sterile gloves. That'll come a little bit later in the year. Any questions on that? Okay. We are going to move on and start talking about the chain of infection. When I say the chain of infection, what am I talking about? The way in which what?
Diseases transferred?
Yeah, the way in which disease is transferred, illness is transferred. There are 6 links within the chain of infection, and we're going to learn about them and what they mean, and we're going to learn about how we can break the chain of infection. How many links must be broken in order to stop the spread of disease? One. We can stop it here, 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 or here. We have 6 places we can stop it. It only takes us stopping or breaking one of these links to stop the spread of infection. If all these links are connected, then we have the chain of infection. Again, only takes one link to be broken to stop the spread. I'm going to show you a little video on the chain of infection, and then we will talk a little bit more about it. Oops. Don't you just do control? There we go, never mind. Okay. Oh. Okay, so that's just obviously a little video clip on chain of infection.
Is causative agent the same thing as pathogen?
Yep, and we'll talk about that now. Good question. A causative agent, Paige just asked, is a causative agent the same thing as a pathogen? Yes, the causative agent is the pathogen that causes the infection to start. You can't have an infection without a pathogen, right? No. So we gotta have a causative agent to start the chain of infection, to begin the chain of infection. So we just said causative agent number 1 can be any pathogen. I want you guys to know a term, normal flora. So we already talked about, you guys all have bacteria living in your body, right? But you're healthy, you're not sick. How could it be? Because we have normal flora that live within our body. Bacteria that does not make us sick. We have microorganisms within our body that are normal, they are not harmful, they do not make us sick. Linnea?
Is that why people take like probiotics?
That's why people take probiotics. There are normal flora that actually help us. They're healthy bacteria. They help fight off the bad bugs that you were talking about. Yes. Another thing I want you to know is certain diseases have an incubation period, which means the pathogen has entered your body, but you're not yet showing signs and symptoms, because some diseases have incubation periods. The time between the pathogen entering the body and the time that it causes signs and symptoms. For example, back in the day when we used to have chickenpox, the virus would enter our body, but it would be 10 to 21 days before we got those itchy bumps. So it was living in our bodies for that long before any signs or symptoms appeared. That to me is scary. Why? Why would that be scary? Because people can be walking around with certain infectious diseases and we could have no idea. They could have no idea because they don't have any signs or symptoms. They feel fine. They're not sick, when indeed they are. That's with coronavirus, that's what they keep talking about, is with coronavirus, people can be walking around with it and not even know. And so that's scary, because how can you prevent an infection that you don't know about? Okay? So, incubation period, another term that is important to know. So, causative agent. How can we stop the chain right there at the first link? First link is causative agent, pathogen. How can we stop right there? Vaccine. If we have a vaccine, a pathogen like influenza cannot, well, I shouldn't say cannot, because not all vaccines are 100% accurate, but can help me not get that infection. A vaccine can break the chain of infection right there at the causative agent. Linnea?
You said a vaccine's not 100%. So does that mean when you get chickenpox that it's still as high percentage you get?
Does anyone know anyone that's had chickenpox?
I mean, I've had chickenpox, but like,
Did you have the vaccine?
it was before. Yeah.
Yeah, so you had it really young. Chickenpox, that one seems like it, let's take influenza for example. That's kind of what I'm thinking about. How many of you have gotten the flu shot and then got influenza that year? Okay.
I've never had flu.
The reason for that is because there are different strains of influenza, okay? So, just because you get the influenza vaccine does not mean you will not get influenza. It helps your chances, but it's not 100%. Chickenpox, I haven't heard of anyone getting chickenpox, so that one must be a pretty solid vaccine. Some vaccines are not 100% though. What's another, hepatitis B vaccine is, polio, all of those vaccines that we get where those diseases aren't around anymore, we don't get them, those are good, those are solid vaccines, yes?
When you get the flu shot, isn't it like you're kind of at like a higher chance of getting it because like they're putting it into you basically?
No, some flu vaccines are a live virus, but it does not, there's lots of different myths and beliefs out there about the flu shot. Some people think, I got the flu shot and it gave me the flu. You didn't get that strain of the flu. There are different strains of influenza, and that's what makes it so controversial, is the different strains. What happens is the people who make vaccines, they predict, or they use whatever science behind everything to predict what is going to be the most prevalent strain that year, and that is what the vaccine prevents against. But there are other forms. Viruses mutate, and other forms of the virus come about, so people can still get influenza, but a different strain. Those vaccines, so influenza is a seasonal virus, right? It comes around every year. Chickenpox and polio and measles and all those things we get vaccinated for are not seasonal illnesses. So that's why influenza is a little bit different. It's a virus that mutates and it comes around every single year. Takeaway from this, a vaccine can break the chain at causative agent. That's your takeaway from this slide here, okay? Vaccine can break it right here. Next, we have the reservoir. We know that a reservoir is anything a pathogen can grow on, right? You saw in the video, phones, drinks. Your body could be a reservoir. The tabletop could be a reservoir. Anywhere where a pathogen can grow. But where do pathogens prefer to grow? Warm, dark, moist places. That's their favorite. How can we break the chain at the reservoir?
Stay clean.
Clean it. All those places where pathogens can grow, we can clean them and disinfect them, and we can break the chain right there, right? Clean the reservoir. Keep it clean. Infections can spread through direct or indirect. Direct spread is when a person gets a disease from another person, and indirect is when a person gets a disease from an object, insect, or animal. Anyone have any examples of indirect spread illnesses? Rabies. You get it from an animal that's infected. What else? Huh? Salmonella. You get it from food. Botulism is, what's that from?
I don't know, but all I know is
Food?
yeah, it's from food. It's like canned food. It's when you can stuff a lot.
Okay, yes. West Nile, or any of those diseases you can get from an insect. Mosquito. Some diseases, you guys, can be spread both of these ways. Can you think of something that you can get either from the person directly or from an object? Corona, either from physical contact with that person or something, hachoo, and then you touch the object.
The flu.
The flu, same exact thing I just talked about. HIV, sexual contact, direct spread. Needle contact, indirect spread. Make sense? Okay. Again, take away from this slide, keeping these places where pathogens can grow clean and dry can break the chain right there. Yes?
Okay, so there's like, wait, you have to like do something when you give blood, like for like blood diseases. Would that mean that you're getting it directly if you get the blood that's infected, or would it be indirect?
If you receive blood that's infected, which should never happen.
Well, yeah, but like, would it be indirect or direct?
That would be indirect because it's not, I mean, the blood's from that person, but you received it from an IV stick. So indirect, I think. That's a really good question. I would go towards indirect because it's not person-to-person contact. Okay? Next is our portal of exit, which the video showed us is all places in our body that things can come out. Our mouth, nose, ears, eyes, genitals, our GI tract. We all go number 2. Our number 2 can be infected, portal of exit. Anything that pathogens can get out of on your body. So, how can we break the chain here? Cover those portals of exit, right? Cover your mouth when you sneeze. Cover that portal of exit so those pathogens can't spread. On page 89 in your books, there's a picture, figure 6.3, of a naked man. Just a visual of the different portals of exit. Nose, mouth, skin, genitals, urinary tract, GI tract, all of those things. Mode of transmission. How can the pathogen travel? There are three major modes of transmission: contact, droplet, and airborne, which we'll talk about more on Friday. Contact is touching the bodily fluid. Droplet, sneezing, coughing, talking, and your spit, saliva particles flying out of your mouth and touching. So I sneeze and my droplets go on to Bridget, mode of transmission, droplets. And then airborne. Airborne pathogens can travel through the air. Those are three different ways in which pathogens can travel or transmit from one to another. How can we break the chain here at mode of transmission? Wash hands. We all have a portal or multiple portals of entry, any body opening on an uninfected person that allows pathogens in. The video said, wherever they can go out, they can also go in. So all portals of entry are the same as portals of exit. Nose, mouth, eyes, mucous membranes, cuts in the skin, cracked skin, all places that pathogens can enter and invade our bodies. How can we break the chain at the portal of entry? Wear gloves and PPE. Protect your portals of entry. And then last but not least, in the chain of infection, we have a susceptible host. Now the video said anyone can be a susceptible host, right? Even you. But some conditions make people more likely or a more vulnerable host. What are those things that make people more vulnerable? Age, pre-existing illness, stress or fatigue, weakened immune system. All of these things make somebody more susceptible to contracting an illness. How can we break the chain here? We can stay as healthy as possible. The healthier we are, the more capable we are of what? Fighting off the illness. Ingrid and her grandma come in contact with the same person who has an illness. Ingrid might be able to fight that illness off a whole lot better than her grandma. Okay? So we both, me and Bridget, could contract the same illness, but she's able to fight it off and I'm not because I'm under a whole lot of stress and I don't get enough sleep. All of the things we do in our everyday lives either strengthen or weaken our immune system. Those people that are susceptible, what can we do for them when it comes to preventing illness? Protect them. Protect our vulnerable. Protect our population with weaker immune systems. I don't know if you guys have heard talk about coronavirus, but we have found with this study and learning new things about the coronavirus that who is the most vulnerable when it comes to the disease?
Elderly.
The elderly and the people with a weakened immune systems. A lot of young, healthy people are able to fight the virus off. Elderly and people with pre-existing medical conditions have a harder time doing that. So we can keep ourselves healthy, all the while protecting our elderly and our susceptible populations or vulnerable populations.
For the mode of transmission,
Sure.
did you say that it was the hand washing? Was
Hand
it?
washing. Because say we have contact transmission and we come in contact with somebody's bodily fluids page, if we go wash our hands immediately, that can stop that transmission right there. Wash it off, get rid of it, wash your hands.
Thank you.
Yep. So, why do you think the elderly are at higher risk of infection? There's a lot of different reasons. Think about it. What happens with age that makes us more prone to infection? Linnea?
Your skin gets thinner, so it's
Your
easier.
skin, that's a huge one. As we age, our skin becomes thinner, weaker, more brittle, looser, and all of those things make older people more susceptible to what in the skin? pathogens in. Good, what else?
Probably for the immune system and slow healing.
As we age, our immune system weakens. It's part of the aging process. It's just what happens. If our immune system weakens, we are more susceptible to pathogens invading our body and not being able to fight them off. Emma also said poor circulation. What does circulation have to do with it? Circulation and wounds, let's think about it. Poor circulation is going to prevent what from happening to a wound? The healing process. The slower the circulation, the slower a wound is going to heal. The slower a wound heals, the more chance of what? Infection. Right. So decreased circulation leads to poor or slower wound healing. What else?
Like all of your major organs start to slow down too.
All functions in our bodies start to slow, which makes it harder for our bodies to fight things off. Movement. You think that someone who lays in bed all day versus somebody who gets up and moves, that person who lays in bed is going to be more prone to what? Infection, because their blood is not circulating like someone who's moving is. Pressure sores are more common because they're laying in one spot longer, all aiding in infection. We didn't mention that elderly people are often hospitalized more often. We get sicker as we get older, and so we're hospitalized more. That increases our risk of HAIs, which is what? Healthcare associated infections, or acquired, same thing. We talked about skin changes, limited mobility, brittle bones, decreased circulation, leading to slow wound healing. Catheters, which we'll talk about in a second, and then malnutrition and dehydration, two things that can lead to infection, higher rates of infection as well. Nourishment is huge. Do you guys think every time you're putting healthy food into your body, ooh, I'm boosting my immunity? Probably not, but you are. Okay, so malnutrition and dehydration can lead to higher risk of infection as well. When I talk about catheters, there's two types. A catheter is a tube inserted through the skin or the body or a body opening that is used to add or drain fluid. IV catheters and urinary catheters. Do we put these in? No. Do we take them out? No. So, thank you. So why do we care about them? Say Mr. Jones has an IV catheter. I'm not putting it in and I'm not taking it out. So what does it have to do with me? You tell me, what does it have to do?
You care for the area around it.
You'll care for the area around it. You still have to take Mr. Jones to the bathroom. So you gotta know where that tubing is, be careful with that tubing, help his IV pull go with him. You have to handle that IV tubing. Hi, sweetie. You can go sit at my desk. Hi. Urinary catheters. We don't put them in, we don't take them out, so what do we care? What do we do with them? We still have to provide care for people with urinary catheters. You can't say, nope, I'm not going in there, they've got a catheter. We will learn in this class how to care for people, do pericare while they have a urinary catheter in.
We're with the residents the most, so like if it's like bothering them or if something, we have to report it to the nurse?
Absolutely, we're with them the most, so we report any problem there may be with that catheter. Do we drain the bags? Yep, we will be responsible for draining the bags, measuring and recording that urinary output. When we're rolling Mr. Jones from side to side when we're changing his bed, do we need to be careful with that catheter? Absolutely. We don't want tugging, yanking, pulling. We gotta know where that catheter is, know where the bag is, and work around that catheter. Same for IVs. When we're rolling them all over the bed, we don't want to be rolling them on that tubing, tugging on that tubing, or harming that tubing at all, okay? So just knowing where everything is and being careful with all of those tubes. That is our job when it comes to this. And Paige, that point was perfect. We got to report anything abnormal we see. If we look at their IV and all of a sudden their hand's the size of a balloon, we've got a problem. We need to go tell the nurse.
Okay, so like if we're taking care of a patient that like eventually becomes weak and like obviously we help them to the bathroom or whatever, but if they like don't like, can they request like a catheter to be put in or something like that?
Because they don't want to have to get up to go to the
Yeah.
bathroom? Good question. Sometimes people will have a catheter for that reason. We all pee more than we poo, usually, and so we have to get up more often to use the bathroom. Especially elderly people that have IVs and they're getting fluids, they gotta go all the time. And if they're a fall risk, they may get a catheter put in for that reason alone, so they're not constantly having to get up and down and go to the bathroom, so yes. If we go into Mr. Jones's room to empty his catheter, and there's no urine in the bag, then we go back 3 hours later and there's still no urine in the bag, we think that's something we need to go report, like ASAP? Yeah, there could be a kink or a block that we would need to report. So all of those things are why these are important to us and what we need to be watching for, okay? Very, very good. We're gonna do a little activity, quickly just to see what you remembered about the chain of command, or not chain of command, chain of infection. So can I have 6 volunteers? Raise your hand if you'd like to volunteer. Nicole, Linnea. You don't have to do anything hard. Emma, Paige, that's 4. Ingrid and Bridget, come up to the front, please. And just stand facing your classmates. Hang on, I'm coming. Okay, what is the first link in the chain of infection? Causative agent. All right, so Bridget, you're going to be our causative agent. What is the second link in our chain of infection? I'm taking it to you. Actually, no, I'm going to take one to your back. You can hold that one. There, you guys just hold these. Reservoir is next. Paige is our reservoir. What's next? Portal of exit. What's next?
Mode of transmission.
Mode of transmission. Next? Portal of entry and susceptible host, okay? So there is our chain of infection right in front of us. I am going to put something on their backs and then we're going to talk some more. Can you guys scoot forward towards Spencer's desk? Your backs are going to still face the board. I don't want anybody to see it right now. What?
Oh, no.
Close your notes, those of you that are in the audience, because I want this to be from memory. And you guys can answer too. What's yours again? Okay, so our audience note should be closed, so we are going to recap what we talked about when it comes to the chain of infection. So we have the 6 links in the correct order. Who remembers how we can break, hold yours up so everyone can see, how we can break the chain at link number 1, the causative agent? Anyone can answer. Yell it out.
Vaccine.
Turn around, Bridget. Vaccine. We can break it right there. Okay? You can turn back around. Reservoir. How can we break the link at our reservoir? Disinfect it, clean it, turn around page. We can keep surfaces or reservoirs clean and dry. Thank you. Say we didn't break it at the reservoir, we have another opportunity to break it at the portal of exit. How can we break the chain link there?
Keeping lids closed.
What?
Keeping them like covered and closed.
Cover your portals of exit. An example, achoo! Cover your cough. Let's see if that was right. Cover mouth when sneezing. Cover your portals of exit. We didn't break it there, so we get another shot at Emma, the mode of transmission. How can we break the chain there? Hand washing. So, we got some bodily fluids or blood on our hands. We immediately go wash our hands to break that possible transmission to somebody else. We didn't break it there, so we get another shot at the portal of entry. How? Wear your PPE. Gloves, PPE. Cover your portals of entry. And say we didn't get it done there, and it's made it to the susceptible host. What do we do now? Or how do we make ourselves less susceptible? What do we do with the susceptible host?
Stay healthy and protect elders.
Stay healthy as you can yourself as an individual and protect our vulnerable populations. Chain of command. Or why do I keep saying that? Chain of protection.
We are the. She's so confident in it.
I
Yeah,
know. Okay, I'm gonna take your, unless you guys wanna walk around with these the rest of the day.
Yeah, stay healthy. Hey, Bryson, stay healthy.
Yeah,
Just
just
yours
yours
are.
Just lay in there, please.
See, that makes sense. I can totally wear this on my head.
Stay healthy and protect your vulnerable. Thank you. Okay, guys, we are done for today, so use your time as you wish. Did someone just say, yeah, say that was long? Yeah. We're not even done.
I know. I feel like this one's showing us like the most information.
It has a lot, and what I like, yeah, what I like is that tomorrow we don't have to do it, we don't have to go back to it, we get a break. And then we'll go back to it.
What are they doing for lab tomorrow?
Partial bath, and then we're gonna learn about giving a partial bath, practice it, and then we'll have the opportunity to practice PPE and test on work stuff, and everybody's caught up. At this point, guys, you can test on both gait belt skills, blood pressure anytime now. It's not due for a while, but we need to be practicing it because we need to start testing on it in the near future. PPE, we can start testing on as well because we learned that Tuesday. Pericare we cannot because why? It's got to be done in clinical. Partial bath, it's got to be done in clinical. Okay? Were you going to ask me something?
Oh, just that I did ambulance yesterday.
And it's not marked. You can mark it.
Oh, wait, did mine do it? Yeah, I did that too.
Go ahead.
With Jill.